again. I'm presenting with Kesh. And it's been always like this topic has been always been close to my heart because during this season, generally we get to see these allergic disorders more commonly in children. So yeah, that is all. So without wasting any further time, I would like to start with the webinar. I would share my slides. I have created a presentation for that. So yeah, there you go. I hope it is visible for everyone. Okay. So today's topic is seasonal allergies in children. We'll see this topic with an Ayurvedic perspective based on the allergic disorders that we generally see in spring. Moving forward, we will see with the growing allergy epidemic over the past few years. This is a survey done by the CDC National Health Interview in 2024. So they say that the seasonal allergies are more common in children. That is more than eczema and the food allergies those are seen during the spring season. So around among 1 in 5 children have seasonal allergies. That is around in a class of, if there is a class of 30 students, there will be six children affected every year with seasonal allergies. That counts to around 30% of the globally, 30% of the global population. And this is rising over the, like, this is a rising trend over the past 3 decades. So why spring? Like, why does these allergies happen in spring season? So spring, there are some allergens or triggers during spring. Those are generally tree and grass pollen, generally mold spores or dust mites, those are activated. As well as there are temperature fluctuations, like from the extreme cold weather, we are moving into the hot weather, right, in spring. And then there is increased outdoor time. We spend more time in the nature. We go for trails, we go for hikings, or we try to go around more in the good weather, right? So that causes some urban air pollutants as well. So once we start exposing ourselves out, so we start getting these allergy triggers, and that's how the IgE mediated response occurs. IgE mediated response is like when the allergen enters, like IgE is immunoglobulin which is there in our body. So when the allergen enters into the airway, the immune system starts to react, it hyper reacts, okay, and the IgE antibodies are produced, and mast cells are like, they're like the defense mechanism of our body. Those release histamines help to, they are activated when there is like, they are activated when they think that this is an enemy in our body, and then they mount a disproportionate response. That's the way allergy is produced. Okay, so it causes symptoms like inflammation and other symptoms like runny nose or maybe cough or itchy eyes, dry eyes, whatnot. But in this season, not all children are affected. What is the reason? So the reason is actually the internal susceptibility factors, which are like related to Prakriti, Agni, and Dosha described in Ayurveda. So Prakriti is like a person's characteristics, and Agni is the digestive fire of a person, and doshas, there are doshas in our body like Vata, Pitta, Kapha, and that's how Ayurveda is. It has a basic principles based on it. So so for non-Ayurvedic people who don't have a general idea about these things, I would like to Imagine, I will ask them to imagine about a Wi-Fi. So we are in the same room, and some devices are connected, but some devices don't connect. There is a difference in the device, but not in the signal. That's how we can compare that all children are not affected, but some children do. Okay. Yeah. So that was a very short example. So let's move around like childhood in Ayurveda. We call childhood as Balavastha in Ayurveda. So generally, childhood is the stage which is dominated by kapha. There is a shloka in Sanskrit that is Balaha Shleshma Dharohi. Balaha is childhood and child, and Shleshma is kapha. So, as a in childhood, generally the kapha is dominated, which is if kapha is balanced in that space, we don't enter into the risks of high kapha. Okay, so for example, like kapha is when it is in protective stage, it is it helps with growth, it nourishes the tissues, it builds immunity, and it maintains moisture. And when it enters, when there is like high kapha because of many things in childhood, like maybe the diet, or maybe the exposure to the weather, or maybe the lifestyle that is causing increased kapha, it leads to mucus disorders and congestion, tonsillar swelling, and skin sensitivity. And on top of that, there is a spring impact on kapha. So in Shishir Rutu, or Shishir means the earlier Rutu, that is late winter, which is before spring, that in that the kapha is accumulated in the body, and then in spring it liquefies. That's why what happens is there are high nasal secretions and decreased digestive fire and allergic risk. Because of a high kapha, our digestive fire is reduced, and that's why we don't feel much hungry in this season as compared to the past seasons. Okay, and due to the reduced digestive fire, the child is at a risk of allergy. Okay, so for so kapha we can think like a clay, which is which is beautiful and nourishing when it is balanced, but sticky and clogging when it is in excess. Okay, so kapha dominant children are like they are when they are in balanced form, they don't undergo any of these risks due to kapha dosha, high kapha dosha. Okay, so let's move on to the further slide, that is spring or the spring season. What happens in spring season? Okay, so Shleshma Vasante Prakopam Agata means kapha accumulated in winter becomes aggravated in spring. The that is this is the same slide that we discussed earlier. Like according and in this way, the modern and Ayurveda understanding comes to a final like similar conclusion. Okay, so what happens according to like what does modern science discuss is the rising of pollen counts. Okay, and there is temperature fluctuation and mold spore release, immune activation, and respiratory sensitivity. And here, the kapha, in Ayurvedic understanding, the kapha liquefies and moves. Okay, that's why the nasal secretions are increased, the digestion weakens, and there is ama or toxins formation in the body, which triggers dosha imbalance and allergy. Okay, so here just think kapha as snow accumulated over winter, and it melts in spring and floods the rivers, right? So kapha accumulated in the body over winter liquefies and moves and creates congestion, nasal discharge, and allergy. That's why I have been like I repeated this slide again, so it will be a better understanding. So The phenomena of modern understanding in Ayurveda is same according to this slide, which was mapped around more maybe 2000 plus years ago. Okay, let's move on to the next slide. That is like our favorite slide for today, which is what are the main allergies those are found in the spring season. The first is Pratikshaya, which is these are all Ayurveda terms which are mentioned in the initial stage. So one is Pratikshaya, next is Tamakshwas, next is Kandu, and next is Netravikar. So Pratikshaya is allergic rhinitis. Okay, so in this allergic rhinitis, this is most common amongst all four. So first, in the first stage, the sneezing occurs. Then there is runny nose. Then there is nasal obstruction. Then itching and heavy head. Most everybody over here must have, been through these allergies, which are quite common. And this can be directly compared to the modern pathology of hay fever. Okay. Next is Tamakishwas, that is allergic wheeze. So there is generally in kids, the wheezing sound is not heard at first, but as the if the pratisha advances, then we can hear the wheeze sometimes while they are sleeping, or maybe sometimes if it is like intense, it is heard during the daytime also while breathing, right? So there is wheezing sound from the chest, recurrent cough, breathlessness, which worsens at night, and there are cold triggers. Next is Kandu or Shita. This is a skin condition which is seen generally in kids. In that they get hives on the skin or there are skin eruptions. Sometimes parents are confused why this happens in spring, because they get confused with the respiratory tract infections and a skin allergy. But this is one of the allergies that are most commonly found during this season. Okay, so generally, there is a lot of itching in hives. It's because of the kapha aggravation. Okay, if there is a correlation of itching and kapha dosha increase. The eruptions are like very, very, soft, but um, redness. There are like inflamed or reddish in color, and the eczema flares up, which are then associated with pitta dosha and causes blood and causes the combination of both leads to the effect of rakta doshti, or there are blood disorders in future. Okay, so next one is netra vikar, that is allergic conjunctivitis. In Netra Vikar, there is a redness of eyes, watering, itching, burning sensation, and photosensitivity. So we just saw the symptoms, exactly what happens in these four phases of spring allergies. And these are like you can see these kind of allergies in every any other children you can see in your neighborhood, or you can find in your neighborhood. So this same aggravation of kapha in different tissues are affected. So what happens is um, pratishaya has to be addressed initially, then to avoid the other disorders. So Ayurveda is always behind prevention rather than treating the further condition. So prevention is the key in the state. Okay. Let's move on to our next slide. That is Samprapti. Samprapti is like pathogenesis, like how allergy is developed with Ayurvedic point of view. In the earlier slide, we saw the clinical interpretations, or the symptoms or signs of allergy. Now we are moving forward to the pathogenesis. The exposure to triggers like pollen, dust, mold, cold winds, pollutants causes weak agni or reduced digestive fire. So this poor digestion creates toxins. Okay. Then there is kapha accumulation. It blocks the airways. Okay. So what exactly happens is when these triggers, they are the initiating factors. It Because of these factors, the ama is activated or the toxins are increased in the body, and then these toxins affect the respiratory channel, and that's why we see all the symptoms that we saw earlier, which in and which are responsible for increasing in vata dosha as well as pitta rakta irritation, which causes inflammation or redness and burning sensation. Okay. And what happens is there are recurrent episodes of this. As we don't treat them or we don't prevent them, there is lower resistance to this, and then the exposure and weakened agni together causes this chronic allergy pattern. Hmm. Yeah, so this is a little, a little complicated way of understanding the pathogenesis, but for the, non-Ayurveda background people. But I would just like to throw some light on these points, like how the pathogenesis occurs according to Ayurveda. So after this clinical symptoms and then moving to pathogenesis, let's move to the treatment part. So in Ayurveda always believes in avoiding the cause, because we always want to, treat the root cause of the disease, not just treating the symptoms. So the foremost treatment is avoiding the causes, and there are do's and don'ts according to Ayurveda, as there are very like Ayurveda always believes in patya and consistency, like dincharya, rutucharya, or seasonal variations. So we will see what we have to do in the season to avoid the cause. Like we have to avoid the pollen exposure during peak morning hours, because the there are it's high during the morning hours. After coming back, like once the child comes home, if they need to wash their hands and face thoroughly after the outdoor play. And the sleeping environment, as a child spends most of his time in the bed, like because the child sleeps 10 hours, more than 10 hours in their bedrooms or in their in their sleeping environment. It should be dust free. Okay. Maintain good indoor air quality, stay dry, avoid damp environments, and avoid sudden cold exposure. Sudden cold exposure, as in, you go out in the outdoors, and when you come home, you come directly into the AC. That is also not recommended. The temperature should be maintained in such a way that it is not much different than the outside temperature. Or if you are at home in like 18 degrees temperature and you go out suddenly, if it's 30 degrees outside, so that also you have to see. There shouldn't be a sudden cold exposure. In avoiding, like we have to avoid cold food and ice drinks. That is very common. Then avoid excessive dairy during congestion. Why dairy? Actually, dairy aggravates kapha dosha, which is kapha is also related to mucus, right? So dairy always increase mucus. I'm not saying that dairy is bad, but if you are like undergoing, or you're suffering with congestion, then at this point of time we need to avoid dairy. Sugary and refrigerated foods, as it affects the sore throat, and it causes high kapha again, high mucus again. Heavy fried oily food, yogurt during acute congestion, late night meals. And these are if these things are avoided from 2 to 4 weeks before the springtime, it helps a lot from getting from transitioning from that weather, from the cold to the hot weather. Okay, but generally in hot weather we feel like having if especially children, they want to have ice creams and they want to have, sugary foods as they want to play outside. But I understand, like we all understand that they are just kids, but to avoid the consequences, we need to be a little strict on these things. Step two, after the Nidan Parivarjan, that is avoid the cause, we reach to the Ahar Chikitsa. Ahar Chikitsa, which means what foods you can give to the children at home. So first is the moong dal soup. Moong is mung beans. You can make this soup at home, which is very light digest and digestible, and it clears ama and reduces the kapha dosha. Actually, moong dal or mung beans are easily digestible, and they pacify all the three doshas. They reduce all the three doshas, and they are very gentle protein for a congested child. So the child also doesn't lose on to protein in their food. Next is ginger water. Ginger water is used as an anti-inflammatory. It clears the mucus as well as it increases the agni or digestive fire. Next is turmeric in food. So while cooking, you can add ginger and turmeric in food, which will help to boost the immunity of the child, and also it will give an anti-inflammatory and anti-allergic response. Okay. Next is tulsi warm water. Tulsi is known to have antimicrobial effect and is adaptable to the body very well. Tulsi is also called as holy basil in different languages, so you can use that. And but Tulsi can be used after the age of 2 years, not before that. Okay. Next is seasonal cooked veggies. Those are easily digestible, nourishing, warmed, and spiced. So seasonal, as in which vegetables are available in spring season, we have to see. Generally, they are, the squash or pumpkin, or those the Chinese okra. These are really good in this season if you make a soup, or maybe add some spices to that. That will also work as a healing food. And always try to give warm meals, never give cold food to children. So the principle is always give warm, light, and easily digestible food, which help in reducing kapha to the allergy prone children. Okay. The third step is Vihar Chikitsa, or healing lifestyle. Initially it was Ahar, next is Vihar. Ahar is food, Vihar is lifestyle. So, every child should get quality sleep, at least 10 to 12 hours of sleep every day, which helps with immune repair and lymphatic clearance. And the erratic sleep patterns in children aggravate Vata dosha and weaken their immunity. So, consistent bedtime routine supports immunity repair and it reduces cortisol. Okay. Next is the morning sunlight. Morning sunlight. We all are very. We know everyone knows that morning sunlight regulates vitamin D. It boosts immunity and improves mood. Also, it helps to regulate the circadian rhythm, and it improves the immunity. Okay. Next is steam inhalation. Steam inhalation is important in allergy prone kids because it clears kapha from the airways and it reduces the congestion, but it should be always supervised. Yeah. Next is and while steam inhalation, you can always add a drop of eucalyptus oil or peppermint oil so that it clears all the passages which are congested. You can do this once a day to avoid congestion. Next is regular bowel habits. What happens is if the child is constipated, then the ama accumulation increases. The ama doesn't move out of the body easily. So this is the reason there should be a daily bowel movement, which has a great emphasis in Ayurveda on pediatric care. So even if there is a simple remedy that a child can have warm water in the morning, which every morning, which can reduce the ama accumulation and improve with his bowel habits. Then next is gentle exercise. Gentle exercise, like you can inculcate any of the exercises, whichever the child likes. Maybe running, jogging, playing outside, or maybe just if the child is older, you can you can introduce them to yoga or maybe brisk walk, whatever the child likes. Next is following the Ritucharya. Ritucharya is the seasonal regimen which stabilizes the doshas and builds resilience. So, Ritucharya is another topic which is a consistent routine which has to be followed in a particular season. So there is a seasonal regimen for spring, like we are discussing right now, and there is again a seasonal regimen when we are entering into the winter, like extreme winter weather. Okay. So if we follow these small dietary changes or these small lifestyle changes, there is a huge, like enormous difference in our day-to-day habits. Okay. And it also prevents from many other disorders, not just allergies. So step four is shaman medicine. Shaman means they are like shaman chikitsa is always related to herbs in Ayurveda. So Ayurvedic, I have just mentioned few of the herbs which are useful. That doesn't mean that you have to introduce these herbs directly to the child. You have to always consult an Ayurvedic doctor or practitioner before giving or administering these drugs or herbs to the children. Okay. So these herbs always are always individualized based on the age, constitution or prakriti, and symptoms and the dosha state in the children. Okay. So these like the herbs like Sitopaladi Churna, Haridra Yog, Yashti Madhu, Talisadi Churna, Guruchi, Pipali. These all have different effects on the body, and there is a time for each and every herb to be given. So and the dosages are are of prime importance. Rasayan is like building immunity from within. Rasayan, so Rasayan means rejuvenation, or it works best as prevention. So just avoid the names of the herbs. These are few herbs that I have mentioned, but these are like very helpful for children in building their immunity. So Rasayan always helps us when we generally started before the allergy begins, not after the allergy starts. Okay, so it helps in building the immunity. So let's move on to the further slide, which is modern medicine versus Ayurveda, a comparison. So, how can we integrate both the medicines or both the sciences together and help for the betterment of the child or the individual? The approach in modern medicine is symptom suppression generally, like it's Ayurvedic medicine and modern medicines work at a different concept. So, Generally, modern medicines treat the acute causes, which is really important. They help with the symptom suppression, like if the child has runny nose or itchy eyes, they give some antihistamines and then or steroids or many other medicines, and they have a standardized protocols for that, and they are managed, and they can also be helped to treat severe symptoms, whereas Ayurveda medicines, they help to treat the root cause, and their focus is main on Agni, Ama, and dosha balance, like digestive fire, toxins which are increased in the body, and dosha balance. The treatments are generally herbs, lifestyle change, diet change, and rasana, that is rejuvenation. Um, Personalization is like it is prakriti based, and always it asks the people to prepare before the season. So if there is an integrative approach of modern medicine and Ayurveda, the acute crisis will be prevented, and there will be prevention and long-term resilience from Ayurvedic treatments. Um, let's move on to the next slide, which is the parents' quick guide for the seasonal allergies. So there are 7 steps. So start with Ayurvedic remedies is the first step, which is to be recommended by a practitioner, and that those are to be started 4 to 6 weeks before spring. Okay, and next is switch to warm meals. Avoid cold drinks, ice cream, and yogurt in spring. You can make notes of this if you want to. These are like you can start doing it before spring every year if you wish to. Keep windows closed on high pollen days, usually morning times. Fourth step is add ginger plus turmeric to daily cooking, which is a natural anti-allergic in the kitchen. Next is the steam inhalation once a day during congestion. These are to be supervised always. Okay. Next step is 10 to 15 minutes morning sunlight exposure, which boosts vitamin D and immunity. And seventh step is always consult an Ayurvedic pediatrician or any Ayurvedic practitioner to know your child's prakriti. Okay. Next. So I have just prepared this slide to share a case scenario with you. So so you will know what exactly we were discussing before. Hmm. So meet John. He's a 7-year-old child with spring allergies, and every spring John sneezes constantly, has a runny nose, itchy eyes, and wakes up at night coughing. His parents try antihistamines. They help briefly, but he is drowsy and symptoms written every year. So we discussed these about this slide earlier, right? So how the Ayurvedic approach for this condition moves ahead. So uh, for this condition like this, and this is very common condition, right? I think from the attendees here, there might be few of the parents which might be whose child would be suffering with this kind of condition every spring season. Yes, so how there is an Ayurvedic approach for this. So warm diet, no cold drinks, daily steam inhalation, Ayurvedic remedies after consulting a practitioner, morning sunlight every 15 minutes. So this is the Ayurvedic approach in that is in the initial state. But then in future you have to think about uh, reducing the reducing the things which are increased due to which occur due to high risk, which are high risk of a factors. I'm sorry. So just try to start with this, and then if you require some remedies, always go for those. So after 2 springs, if you follow these things, after 2 springs, you will see 60% reduction in sneezing episodes, no nighttime cough, school attendance is improved, less antihistamine use, and better energy and digestion. Okay? And the parents got the tools. Yeah. Okay. So this is how the Ayurvedic approach should be. Yes. So moving on to the further slide. Mm, I will just walk through the Ayurveda's unique value. So, not all children react to the same allergens. Everyone's prakriti is different. So, depending on the prakriti, we have to see which of the treatment or conditions are to be treated. So every child has a different symptom, has a different severity of the disease or increase in the like dosha imbalance. So we have to check all that, and then we have to move further. Ayurveda always does this individualistic approach from kids to adults to geriatric age. Okay, so seasonal preparation is more effective than reactive treatment. So I'll focus again, or I'll say this again and again, that we need to follow the seasonal routine, which strengthens immunity before the season hits. Okay, prevention is always to be given the higher preference than the treatment, especially in the children, because they are going to be a healthy adult if we treat them in childhood. Gut health is the central to allergy prevention. Digestive fire is the key to any of the conditions. Okay, even if there is respiratory even if there are respiratory diseases, we have to treat the digestive fires, we have to reduce the toxins that directly impacts on the immune response, and which is actually now paralleling to the modern microbiome research. Okay. And personalization is Ayurveda's greatest gift to modern pediatric practice. The gut allergy connection is the most powerful modern validation of Ayurvedic principles. So, child's prakriti has to be known, and that's how we can reduce the need for daily histamines over multiple seasons. Ayurveda's personalized, preventive, and holistic approach makes it an ideal complement to modern pediatric allergy care. So, the last part of this webinar is um, spring allergies in children parallel the Ayurvedic principle of kapha aggravation during spring. Childhood's kapha dominant nature increases inherent susceptibility. Classic Ayurvedic conditions are four: Pratishaya, Tamakshwas, Kandu, Netravikar, which map perfectly to modern allergic presentations. Prevention through Ritucharya, Rasan, and dietary management outperforms purely reactive approaches. Personalized Ayurvedic care can meaningfully reduce allergy burden, improve resilience, and empower families. Ayurveda offers a roadmap to a sneeze-free spring rooted in the 5,000 years of wisdom. I have just read out this slide, so it is like a summary to for you to let uh, to follow these principles based on the conditions which you see in the child, and hope this webinar was helpful for you. If you have any questions, you can ask me now. I have used classical references like Charak Samhita, Shrishut Samhita, Ashtang Hriday, Madhav Nidan, and Bhavprakash Nigantu. And I've got some modern sources also. which I have used in the further reference in this slides. So I would thank you for listening to me patiently. And if there were any mistakes from my end, you can also correct me. And you can also, share your thoughts and what more topics you would like from us so that we can prepare for our further webinars. Thank you